may sound scary to some people, conjuring up thoughts of pain, scarring, prolonged recovery time, and loss of work. But things have changed. Please welcome Dr. Andrew Lee from American Total Orthopedics, along with his patient, Howard Schultz. Hi there. The procedure has changed. What is it that we're doing differently now?
Yeah, during the past decades, there has been a major advancement in orthopedic surgery in the field of minimally invasive procedures. Now, this is possible because of the development and refinement of endoscope.
Okay.
Endoscope is a thin fiber optic rod that is connected to a camera and a light source, and you can slip this through a tiny incision, and you can see inside the body. And when you use the endoscope to see inside a joint, we call this arthroscopy. Since you can see very clearly inside, you can make accurate diagnosis, and you can provide the treatment with endoscopic instruments at the same time.
Yeah, it's amazing to watch that surgery because it's like you can shrink yourself and go inside the human body there. You were having problems with your hands.
Yes, I
which, by the way, there's several different applications for this on the body. You had carpal tunnel, and you're an electrician, so those two don't go together very well.
Not well at all.
Yeah, so what types of things were happening to your hands?
Well, my hands were becoming unable to use them to handle parts. I dropped parts. I just couldn't.
Yeah. Had you put off surgery for a while?
Oh, I did. I thought, at first, I thought it was just arthritis developing or something. I didn't know better.
Yeah.
And I put it off for a long while.
Yeah, and that's why it's important, Dr. Lee, for people to not try to diagnose themselves, to figure it out, or go to a doctor so you can know exactly what it is that you're dealing with.
That's right. If the symptom is not treated for a long time, you can damage the involved nerve permanently. So it's very important to diagnose early and get early
What is
treatment.
carpal tunnel? Because we know thousands of people, if not millions of people, deal with it. What is carpal tunnel? And then tell us about the procedure to fix it now, which is much less invasive than it used to be.
Yeah. Carpal tunnel syndrome is a pinched nerve at the wrist. Carpal tunnel is like a semi-circular canal, and through that tunnel there are 9 tendons and the nerve called median nerve. And somehow you run out of room inside, and the nerve can get pinched. When the nerve gets pinched, it cuts off the circulation to the nerve.
Yeah, causes
That's
numbness,
why,
pain.
Develop numbness and tingling and night awakening pain.
Yeah.
The treatment is quite simple. All you have to do is get the pressure off the nerve. In the past, we used to make an incision to get the pressure off the nerve. Now we have endoscopic technique where we just use 2 tiny holes. Yeah,
and you know what? I want to take a look at your hands. If you can turn your hands over this way, if we can get a close-up here and take a look, you don't see the scarring that we used to see in years past. There's just like a tiny little mark right there.
Right.
And you said there's another tiny little mark up by his, right there?
Yes. There. He is a very interesting patient because not only he had carpal tunnel syndrome on the right side, he has so-called pronator syndrome on the left side. It's a pinched nerve in the arm. And in the past, we used to make about 4-inch incision to get the pressure off the nerve.
Yeah.
Now with the endoscope, the incision needed is less than 1 inch.
Okay.
So as you can see, the scarring is minimal.
Barely even a scar there. What other parts of the body can we use this procedure on?
Most commonly done arthroscopically are the knees, shoulders, wrist, and hand, and less commonly the elbow, ankle, and the hip.
Yeah, and oftentimes you're up and walking around within the day.
Yes.
All right, Dr. Lee, thank you very much. Glad that you're feeling better. You can use your hands now. Yeah. For more information about American Total Orthopedics, call 866-59-ORTHO. Ortho really works out to be 7846. Or you can visit AmericanTotalOrthopedics.com. We'll be right back.